Hi, I'm Mark Butler, Australia's Minister for Ageing. Thank you for the opportunity to address you at the launch of World Continence Week, an event I've addressed each year for a number of years now. My apologies, though, that I can't be with you in person on this occasion. The Australian Government continues to recognise that incontinence is a significant health issue that has physical, social and economic implications for an estimated 4 million Australians who experience some degree of incontinence in their life. Together with the great work of organisations like the Continence Foundation of Australia, we've made really big gains in terms of improving awareness, prevention and management of incontinence so that more Australians and their carers can live and participate in the community with confidence and dignity. The Bladder Bowel Collaborative has been particularly successful. As you'll no doubt be aware, this initiative is raising awareness of how to maintain good bladder and bowel health, as well as the treatment and management options available to people already living with the condition. It includes the Australian Continence Exchange website that was launched in 2012 and the national campaign which provides important information to patients, carers and health professionals. The Government's pleased to support the important work that the Continence Foundation of Australia has done to better the lives of those living with this issue. And I'd also like to congratulate Dr. Beth Wilson on her appointment as the patron of the CFA. Dr. Wilson's made a significant contribution to research, public administration and ethical practice in law and health and is well qualified for this position. I've no doubt that she'll be an asset to the CFA with her humorous and positive approach, and I really look forward to seeing her in action. As part of World Continence Week 2013, I understand that the CFA is further expanding its efforts to communicate the bowel and bladder health message to culturally and linguistically diverse Australians. I understand new resources are in the process of being developed, including interpreting guidelines for health professionals, language-specific web pages and links to bilingual fact sheets. Can I say that this is a really important initiative and links with our newly released National Ageing and Aged Care Strategy for people from CALD backgrounds, which has been designed to ensure that Australians from all walks of life benefit from our $3.7 billion aged care reform package. Australia has only recently come to terms with the sheer impact and the prevalence of incontinence in our society. That's not to say that many in this room have not known the impact for many years, but it's only recently that we've closed that gap between expert knowledge and whole of community awareness. In response to this significant health issue, the Australian Government introduced the National Continence Program in 2011. Within this program, the National Public Toilet Map was developed, which provides locations, opening times and disability access information for over 16,000 public toilets across Australia. It also includes the Continence AIDS Payment Scheme, providing financial support to help people with permanent and severe incontinence to meet some of the costs of their condition. The Australian Institute of Health and Welfare was also tasked with updating the Australian Incontinence Data Analysis and Development Report from 2006, and I'm pleased to announce the release of this updated report, now available on the AIHW's website. The updated report presents a profile of Australians living with incontinence, and it further investigates the prevalence, burden and financial costs associated with the condition. Researchers, policymakers and governments will benefit from this report as it will improve their ability to identify where improvements can be made in their relevant areas of responsibility. Thank you for the opportunity to address you this morning. I've no doubt this week ahead will prove to be very successful. And finally, thank you all for your efforts to raise awareness of this important health issue and to give more Australians with incontinence the dignity and the respect that they all deserve. Thank you very much.